Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in just about everything that I do. Each week, I'm bringing you physical, mental, and spiritual ways to heal your pain. This series is called Mind Your Spine, where we're looking at how our thoughts, our beliefs, our memories all affect your pain. And today I specifically want to talk about how the words and the pictures that are used to describe your body keep you in pain. So let's talk about some of the words that are used to describe your back. Many people that come to my class they come up to me and they say, I just want you to know that I have a disc herniation. And as they say it, I can see the fear associated with the thought of a herniation. That word is very scary. And other words that are used are a disc tear, a disc rupture, disc deterioration, disc degeneration, joint degeneration. All of these words, when we embody these words, we put fear into our body. And that fear keeps us from moving how we're supposed to move. It freezes us right around the center of the body. And this is really a neurological response to freeze. So let's talk about these words and why they're not so scary. I mean, they're really just medical terms that we've come up with to describe what we see. But really, what is being seen in the spine are normal aging processes. I talk about this in another video, how as we age, the disc space gets narrower and then the soft tissue bulges. So you may hear bulging, or herniation is really when they're talking about the bulge. Now there is some times in an acute back injury where some of the gelatinous material in the center of the disc can leak out, and that's an extrusion or herniation, or people use different terms to describe what they're seeing on MRI pictures, but all of that can heal. And there's another piece of information that you absolutely need to know. All of the pictures, all of these terms that we describe pathology of the spine, some people have all of this pathology and they do not have pain. So just because we can see it and label it does not mean that it's the actual source of your pain. So just think about that for a little bit. Just because you have arthritis of the spine, it does not mean that you need to have pain in your spine. So let's talk about another word. Physical therapists and other exercise trainers have taken, we use, and I've done this too over the years, we use the word stability, core stability. And we'll say, you really need core stability. But in the back of your mind, if you think you need core stability, then somewhere you're thinking, I must be unstable, or I have an instability. And again, that thought of instability, how do you protect an instability but freeze all the muscles of the spine? So if you're someone that has this chronic tension, this tightness that you feel in the low back all the time, it's probably because of the fear of what a healthcare professional has told you about your spine. Fear creates this stress, which the nervous system just reacts to have a lot of extra tension in that area. Now, healthcare providers didn't tell you this because they were trying to harm you. It's what we thought we were supposed to do. But now we really have a better perspective of how we need to talk about pain in order to help you heal from your pain. Let's not give so much credit to the pathology because we know that it's not necessarily the source of the pain. The brain can sometimes be the source of the pain. That fear triggers the response in the brain to tell the body to stay in pain. So all of those pictures, and maybe you've seen the pictures of your spine, had a healthcare professional describe that to you in these medical terms. In some ways, we need to stop using the medical jargon, and we need to think about how we can use words that actually support. So saying, let's support your spine with the core. Let's talk about how we can overcome the natural aging process by keeping a strong spine and a flexible spine. And let's talk about how we can change the mindset around chronic pain and free you from it so that you don't have to hurt all the time. So, along with this video, I want to provide you with some gentle movement, just so that you begin to really embody what your spine feels like. Sometimes we are so scared of what's going on down there that we just try to separate the sensations that we feel from what we know in our mind. So as we begin to think about our pain and our back in a different way, then you need to start moving in order to really feel more confident in your movement. And, you know, say, this is the only spine I've got. I'm going to love it. I'm going to work with it. I'm going to make it the best that I can. So you'll see in the show notes a link to a way to get a video. I think it's a 30 to 40 minute video that just takes you through some mobility of the whole body so that you can begin to feel very comfortable. And that's something else that you need to recognize. Gentle movement to get yourself used to moving is just as good as more intense exercise, especially for people that have chronic pain. So look in the notes for that link to a video just for you. So if you like this video and you want to see more each week, subscribe to my YouTube channel, tap the bell so that you get an alert each week when I post a video. And I'll have more for you each week as we learn to mind our spine. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.